My name is Dr. Bart Clark. I'm an associate professor of medicine at Mayo Clinic in Rochester, Minnesota. I'm telling you today about the recent abstract that we presented at today's meeting on hypoparathyroidism and symptoms associated with it that were captured by an internet-based survey of 374 subjects with hypoparathyroidism. These were subjects that volunteered to report data on their clinical symptoms at diagnosis, but also since diagnosis, and trying to capture and further define what the symptoms that's associated with hypoparathyroidism might be. Questions were asked in the internet-based survey to look at clinical symptoms as well as emotional and cognitive effects of hypoparathyroidism. And to our surprise, we found that there was a number of symptoms that we expected, things like muscle cramping, tetany, tingling paresthesias, and fatigue, but beyond that, there was a number of other symptoms that these patients reported. These included things like depression or anxiety from an emotional aspect. For patients in terms of cognitive function, there was a fairly high frequency of patients reporting difficulty concentrating, difficulties with memory, difficulties fully functioning in terms of being able to do their job or concentrate with conversation even with family members or friends. So the symptoms that were reported were at one level expected based on the known physiologic functions of calcium, but to a larger degree were expanding in terms of symptoms that we didn't typically hear from most of our patients unless asked about, and beyond that, other symptoms that we suspected might occur, but in this case were more frequent than we would expect.